Welcome to Spotlight. I'm Terry Harrington, and I'll be speaking with Dr. Simul Parikh. Today's show is sponsored by the Lake Huron Medical Center. Well, Dr. Parikh, welcome to Spotlight.
Thank you for having me.
Tell us, how long has it been since you've been working at Lake Huron Medical Center, and how'd you come up here?
Yeah, so I've been here about 2 years now. I grew up in Michigan, and I left when I was 18 with promises to never go back. But having small children for a few years out west made me realize that it's good to be home and with family. And also, I grew up loving Michigan, and I want my kids to have the same experience that I had growing up.
Great. Well, we're glad that you're here. Now, your specialty is radiation oncology.
Yeah.
Tell us about that and what you do.
Radiation oncology, it's the use of x-rays to treat cancer. Basically, the x-rays break the DNA in tumor cells, and it does it more effectively than it does it in normal cells. So that's how we kill cancer.
Is this kind of a relatively new technology that we're using?
No, Madame Curie was using this in the early 1900s, who was our first female Nobel Prize winner. But yeah, no, x-rays were discovered a long, long time ago, and they used them a lot back then too, but we didn't know the dangers of it very well. And in fact, she died of cancer because of the radiation that she was exposed to. We've gotten better at harnessing radiation, making it more safe and more effective to treat cancers and actually non-cancer indications as well.
Now, I know in the past we think of cancer treatment, first it's surgery, then it's radiation, then it's chemotherapy, and those kind of things. So this is really a big step and a big improvement for the patients.
Yeah, it's non-invasive. The way radiation works, it goes inside your body, through your body, without you having to get cut. So sometimes we think of it as the most minimally invasive surgery you can get, because radiation does penetrate without causing harm to the external tissues. But yeah, I think it's all three types of cancer treatments have different roles. Surgery cuts it out, removes it, allows us to see it and to figure out how bad it was. Chemotherapy goes all over the body to decrease the chance of it coming back elsewhere. And radiation treats it locally in areas surgery may not be able to reach, or if the location is difficult or would leave disfigurement, radiation allows us to treat it without causing those problems.
Over the years, with cancer becoming so prevalent as it is today, are they finding, is it lifestyle, is it environment? What is causing this cancer?
Well, it depends on the cancer, but a vast majority of significant amount of cancers are caused by tobacco. We're smoking a lot less in the United States, but still about 20% of Americans smoke, and we're still seeing the lasting effects of that. Alcohol is related to cancer as well. There are some lifestyle choices that may increase your risk. Having a high proportion of red meat in your diet can expose you to colorectal cancer. Sunlight exposure can lead to skin cancer. The foods we eat now are processed, and there is an obesity epidemic. Certain cancers are related to that as well. And so it's a combination of environment exposure and lifestyle choices, but there's also a genetic component, things we can't control that we've inherited from our ancestors.
Now, do you recommend people get regular screenings, and how does Lake Huron Medical Center help with that? Yeah,
so screening for cancer is very important. I do want to highlight that we're having a skin cancer screening program May 15th at the North Campus over by Lowe's. It's going to be at 9:30 in the morning, and they'll check your skin to see if you have any high-risk lesions and need a referral to a doctor that specializes in skin cancer. We also screen for breast cancer with mammograms, and the recommendation is somewhere between 40 and 45. You should get a mammogram either every year or every other year, depending on which guidelines you read. An important screening change is that colonoscopies are now recommended at the age of 45, which means I'll be due for one next week, and I'll be scheduling my own. We've noted that younger patients are getting colorectal cancer at an advanced rate. Someone who is a teenager right now, when they're an adult, will have a 4 times greater risk than someone who's an adult right now. And we're not sure exactly why that's happening, because most cancers are going down, but colorectal in young patients is going up. So I do want everybody who turns 45 or has a family history of malignancy in the GI tract to see their GI doctor or their surgeon.
So by doing these screenings, though, that's really being proactive, isn't it?
Right, and the idea of screening is that you find it early, and early cancer is easier to treat. And the fourth cancer that we screen for is prostate cancer, and that's a blood test. We use PSAs. It is somewhat controversial to screen everybody, but again, talk to your doctor about it, and usually about the age of 50, we start PSA screening.
Okay, great. Where can people get more information about the upcoming cancer screening in May?
If you would like more information, give us a call at our center at 810-216-1484. It is going to be on May 15th. Loose-fitting clothes. Come over when you're shopping at Lowe's. You can come on over to the screening, and we'll be able to refer you to the right people.
And there's no cost for that as well, right?
There's no cost for this screening, and then we'd be able to treat it at Lake Huron Medical Center if needed.
Very good. Well, Dr. Parikh, appreciate everything that you do for us, keeping us healthy, and we want to thank you for joining us on Spotlight.